Hi, my name is Madison Tarr. This is my Capstone Project reflection presentation for the BSN for 4600 Capstone class. The agenda that we're going to be talking about is the introduction, analysis, evaluation, and the conclusion. So over the past 3 years that I've worked on my unit, I have noticed an increase in patients needing to go home on oxygen and how long and vigorous that process can be. Working in same-day surgery, our turnover is quite fast following surgeries, but for patients who require extra support, like oxygen to go home with, can require a much longer time in the post-op area, which just makes it a little hard for our staffing needs, and also they get charged a lot of money to be sitting in post-op. And usually surgeons go surgery to surgery, and so obtaining oxygen orders when they are needed can be quite hard, especially surgeons who are currently in surgery, and if it is a long surgery, it is not easy for them to scrub out and pause a surgery to put in home oxygen orders. So usually that ends up meaning that we just watch that patient and wait until we can obtain orders from them. So the whole goal of my project is to just make that whole process of getting oxygen orders for discharge to be a little bit faster and easier. I chose to work with my mentor, Shannon, because she has a lot of experience and is always willing to help. I work with her quite frequently, as she's my post-op charge nurse a lot of the time. And she's always been so willing to help, and if I ever had a question, she's very knowledgeable and is always willing to answer the questions that I have. She also works in PACU, which is phase 1 following surgery, and then post-op is phase 2. So Shannon really has a lot of experience dealing with oxygen immediately following surgery, and then in the post-op phase, which is usually about a half hour to an hour after they get out of surgery, depending on how the patient wakes up. So as Shannon being a charge nurse, she also recognizes the lengthy process to getting oxygen orders, because she is dealing with staffing and assigning patients and making sure that our patients are getting out in a reasonable time, just due to the quick turnover. She also realizes the risk factors for patients needing oxygen beforehand. You can kind of recognize these risk factors. So in the pre-op phase of things, you can know if your patient may struggle with oxygen following surgery, such as asthma, any respiratory problems, asthma, OSA, COPD, if they have a history of smoking, if they have had a shoulder surgery, intensive shoulder surgery, they'll do blocks right in the shoulder. So it being so close to the diaphragm can definitely affect people's oxygen. Also, the medications that the patient may need during surgery and following surgery can affect their oxygen as well. Weight can play a factor in this. There's many different risk factors to this. Also, another reason why I picked Shannon to be my mentor is, as a post-op charge nurse, she acts as a voice of concerns. So if she notices that something that needs improvement, or if there is just things that are not going right in post-op. They do a lot of meetings, and she can kind of voice her concerns and reach out for help or advice or try to solve the issue. So, identifying the potential need for oxygen at discharge before surgery can help initiate the process of getting oxygen orders earlier, which is beneficial again because my department has a quick turnover. And then creating a checklist for getting oxygen orders makes the process quicker and ensures that nothing is missed when it is like laid out in a checklist form. You just can kind of follow the checklist and make sure that you have everything in line before calling and obtaining an oxygen order. Such as in our department, our doctors want a room air trial. A room air trial is if they can obtain at least 90% O2 saturation in 20 minutes. And if they dip below the 90%, they want to know how low they dip and if that patient is able to have the O2 saturation go up on their own and how fast. So usually they want us to get them up and ambulate after surgery to help with oxygen. Maybe avoid certain medications following surgery if that patient is struggling with oxygen. Giving certain medications can make that worse sometimes. The incentive spirometer, they like us to do that as well. All surgeons are different, but those things are just kind of the main things that most of all of our surgeons kind of require before getting an oxygen order to go home. Analysis. So I was very fortunate that I didn't come across many issues with my project, and I was able to stay on track with my timeline for this. I couldn't have done it without the support of my mentor, though. She really had kept me in line and kept doing check-ins with me to see where I'm at and also offer advice and feedback and just help me as well. So I was able to stay on my timeline. It was also easy to collaborate with my team to gather feedback and insight on oxygen-related situations. And so that helped me identify what needs to be done or what can be added to the checklist and how the checklist is going. Evaluation. So following check-ins with my colleagues, I received positive feedback and everything seemed to be running smoothly. Because of the positive feedback and the help that it has provided my colleagues, my boss has chose to keep using the checklist outside of my project, so I'm very grateful. It definitely makes me feel like accomplished. So I guess that is kind of helps me feel like this project did help my colleagues and my goal was achieved. This project has boosted my confidence, showing me that I can my work can make a difference. It has also given me confidence in my managing skills and that I can manage projects similar in the future. My mentor has been invaluable in helping me perform check-ins and refine the checklist before implementing it, and then also doing a check-in with her following check-ins with my colleagues to receive feedback about the checklist. I checked in with Shannon and was able to share that feedback with her so that she can share back, give me feedback on how I should take that information and what I should do with it. My project streamlines the process of obtaining oxygen orders for discharge, making it faster and more efficient. Again, the quick turnover in my unit is crucial for patients to discharge within a reasonable time following surgery if they meet all of the criteria. Due to staffing, it's really important. So identifying the risks of needing oxygen before surgery helps that whole process of getting oxygen to become a little faster. This experience has shown me that I'm capable of making a positive impact on my department. I can identify problems, conduct research, collaborate with my care team, and implement a solution, which is important in managing positions. It has boosted my confidence in advancing my career, taking on promotions, and getting additional responsibilities. It also helps my ability to work with a team to enhance our unit. Conclusion. From the experience that I have working on my unit and observing the increase in patients needing to leave the hospital with oxygen and how vigorous the process can be due to the high turnover rates and needing to make sure that our patients are being discharged in a timely manner. So therefore, the aim of my project was to simplify the process for patients who require oxygen following surgery. To accomplish this, I created a strategy to pinpoint potential risk factors that indicate a need for oxygen upon discharge, and created a checklist that details all the essential steps, expediting and enhancing the efficiency of obtaining oxygen orders. I hope my project can continue to help nurses and doctors with the process of home O2, because it can be a vigorous situation to obtain oxygen orders. I really set out to make sure that this checklist can help people in post-op when trying to obtain orders, but also the doctors, helping them realize that we try to get oxygen orders in a timely manner, and making sure that we have all of our checklists filled out before talking to the doctor to obtain oxygen orders, because it's simply a waste of time to do a room air stat and they dip, and then you're calling the doctor right away, and the doctor then wants the patient to ambulate and do all of these things, and then get back to the doctor when that patient continues to fail the room air trial. So the checklist is just really there to help make sure that we have all of our ducks in a row before communicating with a doctor about getting oxygen orders. So I think I achieved this goal. I've heard positive feedback from nurses. I've also was able to create a little cheat sheet for doctors, because we've run into a lot of doctors not knowing how to even put in oxygen orders. Because it is a prescription, we can't take a verbal for that. The doctor has to put it in the orders, but they also have to put a progress note after putting in the actual prescription of oxygen. So it just kind of helps the doctor walk them through what they need to do so that we can get that process started for the patient to go home on oxygen.